If you ask patients of Northeast Cincinnati Pediatrics what they like most about the practice, you will, in all likelihood, get more than one answer.
I've never felt rushed in their office when I've been back, when the children are being checked. I've always had great experiences here.
The doctors are so nice, they're so laid back, and they want to get to know you. Even the receptionist, they know you when you walk in. And that's great. That's a great feeling when you walk in and they say, "Hi, Mrs. Eversole, you know, how are you today?" And then they greet the kids as well.
With around 10 pediatricians and 5 nurse practitioners, they might best be described as a large practice. But with the practice being broken down into 3 distinct offices, each office retains a small office feel.
I know Northeast Pediatrics is one of the largest in Cincinnati, but what I liked about it is that they still know my children and know me, which is really great for such a big practice.
The nice thing about being a large practice is that we can offer extended office hours Monday through Thursdays as well as Saturday. So in that sense, we have this great large practice that we can accommodate seeing children when they're ill. We can get kids in on the same day generally when they're sick.
Dr. Nicole Baldwin is one of the staff pediatricians. She, like all of the doctors who practice here, is board certified and a member of the American Academy of Pediatrics. The entire staff stays up to date with the latest pediatric innovations and are held in such high esteem that even the world-renowned Cincinnati Children's Hospital refers them to the families of some of their most challenging patients.
Most of our doctors that work here are actually trained there as residents, so we have a good connection with a lot of physicians down there, and I think that physicians that we've worked with in the past, they trust us to take care of their patients. A lot of, complicated premature infants and, chronic illnesses, Down syndrome, Crohn's disease, a lot of complicated patients they'll send to us because they know that we can handle it.
Handling it means taking no chances. They practice what's known as evidence-based medicine.
Evidence-based medicine is basically just what it sounds like. So it's practicing medicine based on evidence that has been shown to actually work. There are a lot of studies out there that tell us, this antibiotic works better for this, and we try to actually practice based on what has been shown to work.
Can I take your temperature, sweetheart?
Ask any parent and they'll tell you kids get sick on their clock, not just when the doctor's office is open. So having an office that offers extended hours, clinical counselors, lactation consultants for new moms, and a staff that can perform everything from sutures to splinting is reassuring during what can be a stressful time.
When I did call the one time at midnight, the doctor actually talked to my daughter on the phone. He wanted to hear her breathing is the reason why he wanted to talk to her, because she was having asthma problems. And I thought that was great.
Staff pediatrician Bob Evans understands that emotions can run high when a child is sick and considers it part of his job to not only give the proper diagnosis, but to do it in a way that connects with family.
The key to keeping people happy is to be responsive to them, to communicate with them, to be honest with them. You treat them the way that you would want to be treated if I went to a doctor's office, and you're going to have success with that.
Northeast Cincinnati Pediatrics has been providing a neighborhood pediatric feel for nearly 20 years. Their unique blend of experience and a family-first mentality keeps patients at ease and coming back year after year.
There are so many great things to say about this practice, and the physicians do such a good job and care so well for the families that throughout Cincinnati. I think when people hear the name Northeast Cincinnati Pediatrics, it really comes with a positive note.